Darren.
Yes, hello again everyone, and I guess this is number 12, update number 12, so which means obviously we've been at this process for 3 months now, and I guess as we look back over that 3 months, a lot of things have happened, a lot of things have changed. In Australia, as we've been talking about the last few weeks, we've escaped a lot of the things that have happened, and I guess today I just want to remind us of where we are now and what that means for us as we keep moving forward. So developments over the last week. Well, across the world, another 1 million cases. So we've got somewhere between a 1 and 2% fatality rate or death rate per case. So if you look at 1 million cases, 10,000 deaths. If we're talking about a situation where we had a world war going on, then that'd be a pretty bad week. And if we look at what's going on, in fact, in the last week there were 34,000 deaths because there's still a situation in a lot of countries where their system's a bit overwhelmed and isn't keeping up very well with the number of people who are sick. So we look at that and we compare that to where we're at in Australia. And for South Australia, we had 1 new case, which you could almost say was a good thing because it's reminded us that just because our borders are shut and we feel that we're completely safe, that's not entirely the case. And across Australia, 85 cases, so last week was 76. I think the week before was about 115. So we're still rolling along, and there were about a dozen cases again this week where there wasn't a clear link as to where they came from. And the last thing to talk about is, I guess, the testing this week has remained pretty good. And to remind everyone again, if you have any symptoms at all, a little bit of a sniffle, even if you lose your sense of smell is one of the features of this virus, if you get tested, then you're making sure that we don't jump from 0 to 1 or 0 to 5 or 0 to 10. We don't want to jump from 0 to 100. So we want to make sure we capture anyone who has this illness. And if you're sick in any way, then we want you to stay home because then you can't spread it. So I promised last week I'd try and give a bit of an update of where we're finding these infections happening because obviously we want to know what is safe. As we open things back up, where should we be more cautious, where can we be less cautious? So the biggest bit is indoors is much more risky than outdoors, and that's volume of air really and air movement. In a big Chinese study, 318 different outbreaks, 63% of the mini outbreaks, the 3 to 5 people, happened inside people's homes. 27% were linked to public transport as the location of spread. And the other area, the food, the shopping malls, entertainment, churches, etc., was only 13% of the clumps of outbreaks were linked to that, but they were quite large outbreaks. And that's where when we go to the shops, or as we're now going to be able to start to do again, go out for a meal, they're places that are inherently more risky for us to catch this virus. In the US, prisons, obviously where people are stuck in the one place, and the meat factories. And that's because it's a nice, cold, still air environment where the virus can just float around, and so lots of people are at risk of catching it. In South Korea, they had a case where there was an office tower, where I think it was the 11th floor of the office tower, and half the people on that floor caught the virus. So a fairly open plan office. And so that tells us if you're inside a workplace and working for hours on end, even if you're not particularly close to people, even if you're away from that 1.5 metres, that can be a risk as well, which is why, again, we're talking about if you've got any illness at all, then stay home. I mean, this week in my work, I've probably sent 50 people off to get a test done, and of those 50 people, obviously no one had coronavirus because we've only had 1 case in SA, but lots of people have had rhinovirus, which is one of your common cold viruses, and it's pretty infectious, and we don't want to see much of that doing the rounds either. So the story continues to keep away. The photo you can see there, most people have probably recognised that Port Noarlunga jetty. So you're allowed to walk along the beach, and if you want to meet up with people, meeting up outside is much more sensible than it is to meet inside. What about schools? We all got told by the federal government that schools were completely safe. Well, no, they didn't really say that. They said they were safe enough to be open. And the data actually does back that up. So we've got a New South Wales study, which really only showed out of a lot of possible contacts, almost 1,000 contacts of somebody who was unwell at school. Only 2 people caught the illness from those people. And the international studies are showing the same sort of thing. And we've got a few different facets to that. One of them is we think that kids shed less of the virus. So if there's a sick child around, they're not spreading it quite as much. And also, children can't catch it quite as easily. And we're not quite sure why those two things are the case, but that's what we're finding. And also when kids get sick, they're usually not very sick. So we're not seeing quite the explosion in schools that we're worried about, but obviously it's still a place to be fairly careful. And let's look at what's going to be opening. As of tomorrow, it's been moved forward. It was meant to be 5th of June, it's now 1st of June. You can go back to the cinema. There'll only be 20 people allowed per cinema, per separate different theatre. Galleries, museums, beauty parlours. I think some of us probably do need to go back to the gym. So I certainly need to go back to the gym, or I need to do something. Dining is going to reopen. Funerals move upwards in numbers. And you can go back to some of your sports. And I guess this is a progression as we move forward. If things stay under control, then more and more things can be reopened. And down in the bottom corner there, we're looking at, the words being used now are moving away from social distancing to reminding us that we're actually talking about physical distancing, which is something we've talked about before, but I just wanted to remind people that it's actually a good idea to make contact, but we don't want to be making contact in such a way as to put that other person at risk. And my final slide, and Darren's tip again, is that we need to comfort and support each other. So if we read from 1 Thessalonians chapter 5, now we exhort you, brethren, warn them that are unruly, comfort the feeble-minded, support the weak, be patient towards all men. So I guess the first bit there is that we need to be reminding each other. If you're catching up with somebody and they're forgetting about physical distancing, then it's worth reminding them. Certainly at my workplace, we've got a problem. Our waiting room, I'm a doctor, obviously, doctor surgery, our waiting room only fits 20 chairs. And there are 13 doctors' offices. And so we either have to run really on time, which is not going to happen, or we have to do some phone calls or get people to wait in their cars. And we're an exempt business. We could go back to stacking our chairs in nice and tight, but that wouldn't be sensible because it's not sending the right message. And for us as a church, we obviously want to be sending the right message. And we need to be making sure we're reminding people of how they stay safe, but we also want to be comforting and supporting each other. And if you're listening to these things for the first time, the reason, as you've heard today, that we are more comforted than maybe a lot of the people in this world are, is that we've got God in our lives. So if you're hearing these things, you're not quite sure where it's all coming from, then please ask us a little bit more about it, and we'll be able to tell you. Thank you very much.